So welcome everyone to today's Lunch and Learn session. We're very delighted to have Cale Watson, who is the Managing Director of Medical Equipment and Gases Australia, Pty Ltd, a family-owned and operated business with more than 25 years' experience in the medical gas industry. Cale's based in Sydney and oversees supply, servicing and maintenance of medical gas equipment for healthcare facilities across Australia. Prior to this, the business specialised in medical gas cylinder distribution, and Cale previously worked as a solutions architect in the IT industry. So welcome, Cale. Feel free to put questions in the chat and Cale will catch up with them at the end. Did you want questions to come whilst you're going through your presentation, or happy to hold till the end of the session?
I think if we can hold to the end, that seems to be the best way, and we can obviously see if any duplicated questions come through, and then obviously just attack it all in one go.
Okay, so I have to jump out early. So when we get to question times, Cale, if you just ask people to come off mute to fire their question away. And just a reminder to everyone, if you can mute during the presentation, mute your microphone. These sessions are recorded and go on to the IHEA website, so people who haven't been able to attend today can catch up on all the details. So welcome, Cale, and look forward to your presentation. Thanks.
Perfect. Thank you very much, Michael. And thanks everybody for attending. We are very excited to be presenting this IHEA Lunch and Learn for you guys today, and just generate some positive discussion. We really enjoy being a part of the growth and development of the healthcare engineering sector. And we, whatever we can do to play our part and support your facilities, we're really happy to do so. So look, hopefully you get a lot out of this. And as Michael said, at the end of the session presentation, we'll do a question and answer, and hopefully we can generate some really positive discussion around what we're talking about today. So the presentation today is just to discuss the consolidation and efficiencies in medical gas testing. The medical gas maintenance landscape has changed a lot in the last couple of years. There's been legislative changes, there's been developments, and there's ongoing review of facilities and maintenance, and all these directives coming around medical gas use. So we will try and provide a bit of a discussion point around what we could be doing to look at the providers that we have in our medical gas testing, and what we can, what we've seen in the market, that other facilities have been doing to streamline their medical gas testing and maintenance. So the agenda today will be to discuss, firstly, the compliance aspect of the medical gas testing landscape. And as I mentioned, the legislative and Australian standard components. Then we'll talk about the consolidation methods. So can I consolidate? Can I reevaluate? Can I discuss these options with other contractors? And what are my options? And are my facility goals being achieved? And is my contractor supporting those efforts? And then obviously results. Do I have a clear results plan? Do I know what I'm trying to achieve with this? Is it as simple as ticking a box so that my audit gets passed, or am I looking at a more broader perspective of reducing my volume of gas use, protecting staff and patients, reducing my admin time and operational costs around this engineering aspect? I do want to quickly mention that really today, this presentation is not built for promoting you to change suppliers. It's not about, this is the one way to do it and that's it. It's trying to highlight the view and perspective that you can take on really, if you wanted to go and reevaluate this, how would I do so, and what conversations should I be having? It's about understanding your options and helping you to generate healthy discussions around what solutions might be out there for you that you might not have known about previously. We'll talk about, I guess, fragmented versus consolidated approaches. And then we'll walk through some of the results that we've seen in the market and what that could look like for you, or what benefits we've seen. So, throughout this conversation, it's just, how does this compare to my existing approach, and what am I doing different to this, and have I thought about that before? So the operational challenge, the significant challenge, coming from the engineering department to have to coordinate the maintenance of these services and facilities across all these different areas of the hospital, of the healthcare facility. So obviously the operational challenge, the compliance aspect of this is really looking at it's a central part of and this is the everyday model, and how do I facilitate or work with these other departments to get the best result for everybody? And have I got that, in my consideration of who I'm using and how I'm using them? Have I thought about what contractor I'm using, and are they working for all of my different departments, not just for me? Am I thinking about how this contractor is solving a problem, outside of the basic agenda that might be, testing an outlet or maintaining a pipeline system? So to touch on the main, concerns at the moment, the legislative changes that have happened around medical gas licensing and medical gas standards have been significant. I know that in New South Wales, ACT, and Queensland, and I'm sure it's on the cards for the other states if it hasn't already. I apologise if I'm not up to date with the specific legislation in these other states, but I know that it's all been mirror imaged from the single framework, which is really that medical gas technicians need to be licensed. They need to have a contractor license, and then they need to have individual either medical gas fitting technician licenses or medical gas technician licenses. And your contractor or your maintenance provider should be incredibly aware of this. They should be promoting this with you and ensuring compliance for your facility and for themselves around the work that they're doing and the reporting methods. Because previously, the Australian standard AS2896, and obviously on the device side of things, 3551, but AS2896 was not legislated. It was purely a framework in which everybody tries to stick to. Now in these other states, and what is slowly being rolled out further, is that this is not just a suggestion, it is now law and it is enforceable. So the standards at which your reporting and work is being completed is now incredibly stringent. The reporting methods and the quality of work that your contractor should be providing should be in line with the law, and you should obviously be coordinating and helping them to achieve that, but it comes obviously from their directive and their ownership over that medical gas environment for you, and the testing methodologies that they're using and the reporting methods, and the safety methods that they're using to maintain and support you to maintain your facility. So when you're working with this contractor, I think that's a key question is, are they constantly talking to you about these standards? Are they constantly pushing for the best quality of work? We understand that there's rising operational maintenance costs. There's a lot of, factors to, the work that needs to be undertaken, but we will touch on obviously efficiencies that can be looked at to alleviate the pressure on your contractors and utilize the right labor and the right resource for the right job. I guess when you look at medical gas testing, it's not just a technical problem. It's an operational issue. Medical gas goes into so many different outlets. You've got the concerns around nitrous oxide in health facilities now. There's a lot of factors that are going into this, and you should definitely be looking at a contractor who's willing to support this challenge and not, drag their feet on, helping you achieve the best possible result. Okay, so I guess we'll compare these two different models and talk about, I guess, where are you at the moment? And again, this is not about changing suppliers and looking for a one-size-fits-all person. It's about understanding the benefits or the pros and cons. And consolidation does not mean necessarily moving to just one person for the whole system, but it might be a single partner when it comes to, can somebody do the devices and the outlets at the same time? And then can I just leave the plant and engineering components, the large capital plant equipment and bulk vessels and manifolds to the engineers, to the engineering, medical gas engineering team or company. There might be, an ability to consolidate the engineering company if they're capable and willing to take over, the outlets and devices. There's many different options, but we'll talk about, obviously here the pros and cons and what they can lead to. So when you look at the different elements, obviously the administration burden of multiple vendors is quite high. Having multiple departments manage multiple vendors, multiple different agreements, it can be quite messy and can take a lot of time. And then you've obviously got site disruptions. We know firsthand that obviously, you might have one person come around and do a medical gas outlet test 1 week, and then 2 months later, you've got the biomedical, the clinical engineering contractor coming around the week after to do the devices on the wall. That obviously causes significant disruptions in the wards and frustration, with the patients and the rest of it. You've obviously got duplication, and then the biggest one is obviously safety. I think a really strong consideration in your medical gas testings, as we just spoke about with the legislative changes and the enforceable nature of the standards now, is who's responsible. And unfortunately, when you might be using multiple contractors, they might be able to pass the buck, but in a similar sense, if you've got somebody testing your medical gas outlets and then reporting a fault back to the engineering firm, well, that's also really positive because they're supporting you to get the best possible result. And, it's about understanding the goals of your organization and whether that contractor is working collaboratively with you to get the same results. If you've got a medical gas company doing your medical gas system, well, would they be on the same side of you or your organization to reduce your medical gas use? Maybe, maybe not. It's about understanding your goals and then picking contractors or exploring your options to utilize the right contractor for the right job and understanding, can they provide support for me in other areas if I know that, I'm having a lot of problems with my, gas engineering firm. They never show up on time. They don't present well. They walk around wards, like a plumber. But I love my device company. They're amazing. They're professional. Well, could they help you? Could they do the devices and the outlets at the same time? Are they licensed to do so? Are they capable of doing so? Or the opposite? I love my gas company. They're incredible. And my engineering firm are not great. It's about, working with these different models to get the best result for you, to know the pros and cons of each solution. Obviously, in this market and this day and age, unfortunately, sometimes the quality of work is overlooked by the compliance, and that's not going to go away. We are all beholden to reporting and to ensuring that we have done the work that we've paid somebody to do or we've done. So obviously, when you're working with multiple contractors, or if you've got a single contractor model, these are obviously considerations around consolidated reporting. Do I have a full snapshot right now of what has all of my outlets and all of my equipment met the right standard? Who is accountable for what? So if you can double up on accountability, that's fantastic. If you can, have your contractors collaborate, introduce them to each other and have them collaborate, where possible, it is very, very, very beneficial. If the engineering department is not talking to their clinical engineering department, well, that is a problem in medical gas outlet testing, because when a device is connected to the outlet, you might have a significant leak that you are looking for because of the significant gas wastage that's going on in the facility. But it's actually got to do with the device connected to the outlet. If you've got a contractor that can do the outlet and the devices at the same time, well, they're motivated to get the best result from day one, about the best possible result. When they stand there and touch the outlet and the device at the same time, they are trying to eliminate leakage as best as possible. But if you've got a contractor just touching the outlet, and they walk away and their flow meter's broken, well, you're not going to know that as an engineering firm, and it's going to take multiple weeks for that to get passed back down to the clinical engineering team to then have that issue resolved. So the collaboration between contractors is critical. If they can report any of these minor faults, and if you can have healthy conversations and pass this feedback on to other departments, or if it is yourself, that's fantastic. That's obviously that proactive risk management, trying to identify holistic system overview issues, not just, well, my problem stops here. I don't have to touch that. It's not my issue. Somebody else can deal with it. Really working with your contractors to achieve the best result for you. So one of the goals that we see primarily, I guess, in this space is the reduction of operational costs. So everybody is looking to get the lowest possible price and not have their budget chewed up by additional contractor services. And what we see more often than not is that the increasing costs typically come from the lack of coordination between service providers, and the lack of accountability between service providers. Because what will happen is you will call out a contractor to troubleshoot an issue on an outlet, but it's actually got to do with the hose attached to the outlet that's running to the ventilation machine. Sweet, well, that's not my problem. Pay me my call out fee. You've got to pass that on to the biomedical team or the ward. They've got to then bring in that contractor to fix that problem. And you've now duplicated your costs as an organization just because of that one issue. You also might have a contractor who is covering up their mistakes and constantly coming back to revisit work that should have been done, once. And if you've got multiple vendors able to assist you with cross-checking that quality of work, then you will significantly reduce your administrative costs in your budget and in the hospital's budget by being more intelligent about the way we use these services. Efficiency of scale, as I mentioned earlier, that duplication of labor with the outlet testing and devices at the same time is significant. It is a huge cost, and in these days, it's not overly necessary, and it actually can be incredibly simple to solve. And then obviously leak detection, as we've come across multiple times here, but having multiple vendors or a consolidated vendor when it comes to a certain area, they will be able to do a holistic leak detection process rather than just completely stop, at a single element and be able to say, look, sorry, that's not my problem. I'm not able to fix that. When you consider the holistic framework of your medical gas pipeline and supply system, you can talk about obviously the plant equipment that obviously is at the source of supply. You've got the pipeline and gas work itself, the copper piping. You've got your outlets, devices in the ward. So those components obviously are where you would be looking at who you're using and why you are using them, and am I getting the best out of each of those resources? When it comes to assessing your vendors, as I touched on at the beginning, and I've tried to highlight, I find it's incredibly important for that vendor to understand your goals. And are they willing to go the extra mile for you to help you get the best result for your facility? Do they understand the regulatory compliance and certification? And are they the champion of that for you? And are they helping you to understand that to the best of your ability and making sure that there's no gaps in that process? Obviously, the technical capability and specialization. Obviously, we've spoken about consolidation here and options there. But using a one-stop shop can often mean that you're getting outsourced support, and that means you're copping the cost of high administration. And if you're having a conversation with that vendor, it's really important to understand what they do and don't outsource, because your turnaround times, your quality of work, that contractor that your provider is outsourcing to won't be looking to achieve your facility goals. It doesn't matter to them. So really identify what they're outsourcing and why, and have a healthy conversation with them about what gaps you can close to, reduce that where possible. Because having a secondary outsource means that, I guess, that quality of work and that level of analysis and goal setting is not as streamlined as what it could be. What's their framework? How often are they coming out to you? What staff do they dedicate? Single account managers to your location? Do they, have multiple service providers coming to your location day on, day off, day on, day off? What consistency of service do they provide when they're doing your work? Really understanding their operating methodologies will help you a lot to understand if they're right for you. When your wards, your NUMs and your other facility staff, you'll understand what they're expecting from you in the collaboration of these facilities. And so understanding their framework is really important. Clearly, response times and service coverage is critical. I know it's not easy for a lot of the regional locations, and this is a constant problem, but you can find contractors who will come and do a 3 or 4 week stint. They'll do the brunt work of everything, and then you can obviously discuss remote service troubleshooting and and backup contingencies where possible. That might be better than using a substandard local contractor who doesn't know what they're doing, who is not capable of maintaining it to the quality required, and will cause ongoing issues. So similarly, you might use a local contractor for some of the basics, and then get in a specialist for other higher risk items. Obviously, safety, risk, and incident management is critical, clearly showing your expectation around what you would expect from them in these situations, and their response to those incidents. And then, cost transparency and value. I would challenge everybody on this meeting to really speak openly with their other people in the industry to understand what costs are they paying for these services, and what what options are you using, how are you using that person. Oh man, I didn't know that they could do that. Geez, I'm getting charged twice as much for the same thing. Why is that happening? So, that's critical. This is a open market. I think people should be very much challenging the current cost structure of their existing provider and seeing if there's any alternatives and why. And if you're assessing other people, you can really understand what cost benefits you're getting. So I guess talking generalist about some of the gains that we've seen from consolidation or reevaluation of service providers. When we have worked with our facilities over a 2 to 3 year period, we've seen significant uptick in compliance accuracy, and that's typically due to ownership or understanding who is responsible for what element and component of the medical gas system, and being able to call them, and support other contractors and to achieve the same result, wanting to work collaboratively with other contractors to achieve the right result for the facility, and being able to, troubleshoot those issues behind the scenes rather than having to throw that back on the facility themselves. Obviously, administrative time savings. Similarly, if you've got the right contractor who's willing to go the extra mile and not just throw it back on you, if you've got somebody who knows their compliancy standards, who knows the reporting methodology that needs to happen, who knows the sign-off and quality procedures that need to go along with the medical gas system testing and maintenance, you really will find that there's no longer having to double check and cross check and validate work. You will have somebody who's willing to work with you to reduce your, and they'll come up with intelligent solutions around how to solve your current problems, rather than giving you a one size fits all model. Obviously, site disruption is critical. We're constantly looking at, ways that we can reduce interference with the wards, and obviously issues, by performing the work correctly the first time. Identifying issues well ahead of time that could be resolved intelligently and proactively, not just leaving it to the last minute, and supporting the facility to go to that level and work with us to get that result. And then obviously cost savings. As I've said, if you can use the right contractor for the right thing, and if they're going to be working with you to achieve your goals. You're saving costs on your gas usage. You'll be saving costs on admin time. You'll be saving costs on compliancy and regulation concerns. There's significant efficiencies to be gained there. So obviously the main goals are really to reduce the duplication of labor, unify your safety standards and obviously enhance accountability. If you can have multiple contractors or service providers helping you with accountability and taking on accountability for your system, and then providing a secondary, voice and over review of that, it becomes very, very pleasant to deal with this, and it doesn't have to be a scary and concerning element to the facility that sometimes looks like it's a bit under a cloud. People don't understand, medical gases, it's so dangerous. God, I just have to do what they tell me to do. Not at all. You should be looking for backup alternatives. You should be getting a second opinion from a competitor, just because it helps to upskill you in understanding what legs do you have to stand on. Sometimes you don't have to go with a complete overhaul solution. Maybe it is better long term to decommission some of your services. But really looking for a collaborative solution and not just working with that single provider to give you that will really, really generate some positive results. So reiterating what I mentioned at the beginning, but it's not about changing providers. It's just really about reworking and revisiting some conversations with other departments, with other contractors, and opening the mind up to thinking, I just thought gas companies had to do this work. I just thought engineering companies and big building companies did medical gases. Surely you can't get somebody else to do it. And that's obviously it's not a healthy mentality. I think understanding what's out there, I think researching a problem and discussing it with other facilities is critical. I would reach out to people in other states, in other areas, to understand what they know, and really looking at, can I get a better result if in my gut I feel like this vendor is taking me for a ride, or if I'm kept in the dark about things on purpose. Well, that's not a healthy relationship. You should have a really positive relationship with your medical gas system provider and maintenance provider, and you should be able to work with them on collaborative goals that aren't just always cost reduction. They should always be, about facility safety, maintenance, and services, and trying to continuously monitor and review that current setup so that you can have the best result for your facility where possible.